Hi, welcome to the third and final tour through a series of CT images of my abdomen. So, quick background for anybody who jumped straight to this one. A couple of years ago, 2 years ago really, I had some severe abdominal pain when I was on vacation, went to the hospital and, as is common, got a CT scan to check and see if I had appendicitis or some other weird thing going on. That wasn't the case, but in this third installment I actually have solved the mystery of my abdominal pain, and it was not caught during any of the other workups. So I'm straddling the line between amazed and irritated that it took me reviewing this material to actually figure out what was going on rather than at the time. But let's not dwell on the past. Let's dwell on what we got right in front of us. So here, it's an abdominal CT, but it's starting fairly high up, so we can see my heart here. For anyone who's unfamiliar with the basic layout of a CT or MRI scan in the axial or horizontal plane, you always look at it as though the person's on their back. No problem there. We've got the spinous process of the vertebra right here, and with their feet coming out towards you. So if you envision this image being someone who's coming with their feet out of the screen, this is the left side, and here's the apex of the heart, matches up, and this is the right side. So as we continue down, we'll tour through the transition from thorax into the abdomen and see the organs there. Now first off, we've got my thoracic aorta here and my esophagus vein right there. And this little indistinct blob that I'm covering, it's just to the right of the pointer now, that's my esophagus, smack up against my left atrium of the heart here. Keep an eye on the right atrium, because as we tour down, you'll actually see the inferior vena cava just kind of bleb off of it as we descend and move towards the thorax. So right here we've got my lungs. We'll take a quick detour and actually check those out, because it's kind of a cool picture right here inside the lungs. We can actually see the spaces and vessels in the lungs themselves, a little bit of a starry night appearance, and you can see the fissures associated with each. Here's the left lung, oblique fissure, and the oblique fissure of the right lung. Can't quite see the horizontal one because of how low we are, but here we hit the diaphragm and liver, and the lungs just barely hang on, extending down a bit further posteriorly, but most of that is abdomen thereafter. So let's move back to the previous view, and here's the inferior vena cava jumping into the right atrium of the heart, and we'll go a little bit inferiorly and it'll be a separate structure. Here's the aorta, esophagus vein, esophagus, keep your eye on it. It's about to have an air bubble in it that gives us another clue as to its identity. So there's the esophagus. Inferior vena cava is associated with the posterior aspect of the liver, which makes sense. And the diaphragm is not super clear, separating the lungs from the liver, but it is there. We can see it a little more clearly right here and over here, separating the abdominal cavity inside the curve that I'm outlining, and the lungs and thoracic pleural cavity on the outside. So we travel a little further down, and at this point, here's the inferior vena cava. It's a little bit covered by the liver. Let's just see if we can get a little clearer view of that. A little bit of distinction there. But there's the inferior vena cava, thoracic aorta, transitioning to abdominal aorta. And here, we've got the stomach. So I'm going to roll back up a little bit. The stomach's right here. The esophagus is right here. And they haven't yet met each other. So in a moment, we're going to see the esophagus slide into the stomach. And it's relatively quick. Not super clear, but right there is my esophagus joining the stomach. So there's the cardiac region of the stomach, the fundus being the big superior bulge. And over here on the left, closely in contact with the stomach, is my spleen. So we'll go a little further down. Diaphragm's laying out, separating the pleural cavity from the peritoneal or abdominal cavity. And here, inferior vena cava, aorta, and we've lost the esophagus vein. It's kind of joined in with some lumbar segmental veins a little further down. And here, we're starting to see some of the vessels associated with the liver. So we've got hepatic portal vein coming together right here from the splenic vein, the superior mesenteric vein, and diving into the liver right there. We'll re-explore those vessels in a little bit. Right now, let's pay attention to the organs. Here's the spleen, here's the stomach, and as we move a little further down, we're going to see more and more loops of bowel. So here's some of the small or large intestine here. We're going to see a lot of that, and we'll follow it in detail momentarily. So here we keep going a little inferiorly. This kind of patchwork looking structure here, this is actually my pancreas, and it's going over towards the hilum of the lung. That's its tail. The body is doing a really weird thing. It's kind of migrating a little bit anteriorly here and then working its way around here more medially to associate with the duodenum. So here's the stomach right here. As we go further inferiorly, it's actually moving very anteriorly. It's got some gas bubble right there in it. A little further down, we've lost the left lobe of the liver. As we moved far enough down, it's no longer present, but the huge right lobe of the liver is going to be with us for a long while. And here, the stomach's transitioning to the duodenum. So right there, we got a little pinch point representing the pyloric sphincter, and we've got the first or superior portion of the duodenum, and it's very anterior, and it's going to transition to become retroperineal and lie down along the body wall. And this is probably it right here, but we'll get sorry, that's the inferior vena cava. We'll get a closer view of the duodenum in its entirety in just a minute. So here, duodenum is transitioning posteriorly, and right here, I've got the pointer tip just to the left of it. Gallbladder is sneaking in right there as well, so the gallbladder on the inferior surface of the liver. And right here, we've got the descending or second part of the duodenum, and it's going to transition this way to the left as the inferior third portion of the duodenum. And as it does so, it's going to pass anterior to the superior the superior mesenteric artery will pass anterior to it. And we've got the head of the pancreas right here sitting in that concavity formed by the second part of the duodenum, the descending part. So head of the pancreas here, descending duodenum here, and we keep going inferiorly, and it becomes the third part here. Now at this point, the third part is going to actually ascend and become the jejunum, some of which we can see right here. So to see that happen, I've got to reverse direction and actually go superiorly and watch for this to jump into the jejunum, and that's happening right about here. So we've got, let's see, duodenum transitioning here, ascends, and as it ascends, it's going to turn into jejunum. Right there's that transition point, and then as we go down, we just get more and more loops of jejunum in the area, filling the abdominal cavity, largely on the upper left side, and as we transition to the lower right side, we're going to see more and more loops of the ileum as the small intestine's major subdivision. So here we can see a nice clear pair of vessels. The abdominal aorta is on the left, the inferior vena cava is on the right. We've picked up the kidneys, so hooray, kidneys are right here. Liver is barely hanging on over here, and actually looks a little bit like the spleen. So if we roll back up, we can see the spleen is here, getting smaller and smaller as the kidneys become a little more prominent. And here, we've got a lot of small intestine, and we're not really going to try to follow it all the way around. What we're going to do right now is take a little bit of a jump inferiorly and look for the ileum diving into the cecum over here in the lower right quadrant. So I'm going to go down considerably. So now we're in the pelvis, and this loop of bowel right here, these are loops of the ileum hanging out here. There's the rectus abdominis muscles right there, and here the ileum is going to work its way into the cecum, and that's what's happening right here. So we've got the ileum making a turn, coming in and joining the cecum. If I go a bit more inferiorly, I'd look to see if I could spot the appendix leaving the cecum. And I really don't see that, although this little pouch here looks a little bit too big. I think that's just a fold of ileum that got thrown across here. But appendix could be there, could also be retrocecal. That little nub is kind of suspicious. Maybe appendix, hard to say. But my appendix isn't inflamed, thankfully. I had another issue, let's say, to thank for my abdominal pain. So now we're going to reverse direction and ascend as we're in the ascending colon. So we'll go the opposite direction and follow the colon here. The material in here is fecal material and gas, which makes it a little bit easier to spot. as we approach the liver, the ascending colon migrates a bit towards the midline, and at the hepatic flexure it actually becomes the transverse colon. And here we have the transverse colon. If we watch as we ascend, we'll get the two of these tubes coming together. So we go a little further up, 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 and right there is that transition. Hard to say exactly where that is, but here we've definitely got a mesentery holding this part of the colon off the body wall. So the transverse colon has a mesentery. If I keep on going here, we can see that it really dips down. So we had to go up to get to the transverse colon, then the transverse colon dips inferiorly. We'll follow it down, 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 and here where it's crossing over, its mesentery laying out behind it, and we transition all the way to the opposite side. The left side is where the transverse colon will become the descending colon. It does that in the vicinity of the spleen, hence it's sometimes called the splenic flexure. So here, my descending colon actually tends to be pretty collapsed. It's right here, and here's where that transition's happening. So transverse colon right here, don't confuse it with the stomach, which is hanging out right here, but transverse colon, where'd it go, is right there, transitioning to become the descending colon. And now the descending colon heads inferiorly, sticks itself to the body wall, and it's really, really tight. It's very difficult to tell that that's actually part of my large intestine at this point because there's no gas in it. It's relatively collapsed, but what it does hereafter as we descend is actually pretty characteristic and pretty telling. A little bit of a lumen there, but as we keep going down, down, down towards the pelvis, it's going to migrate medially and it's going to get a mesentery. And at that point, it's going to form kind of S-shaped loop, hence it gets the term sigmoid colon attached to it. And right here, the sigmoid colon's job is to travel from the left posterior body wall down here to become the rectum. And in this view, this horizontal view, we can see that happening all at once, and boom, there it is, all the way down. Now, for any sharp-eyed people in the room, yeah, looks like I have a little bit of diverticula going on here, so maybe a little more fiber in the diet. Hard to say if those are individual gas bubbles stuck in diverticula or just gas bubbles mixed in with fecal material. But either way, a little bit of a cause for concern. But we'll get back to other health problems in just a minute and the cause of my abdominal pain. So the sigmoid colon allows it to transit from the left side into the midline, and here it's going to head inferiorly, and we'll see it's relatively tight here, but then the rectum expands tremendously, and the rectum's full of gas, hence some of the abdominal pain I was experiencing. And we go further down, it gets tighter and tighter as we approach the external anal sphincter muscle, and that's what's happening right there. And at that point, we're pretty much done. Some of the musculature is still present there. That's the end, quite literally. So let's back it up a little bit and take a look at the blood vessels. So here, we've got the thoracic aorta transitioning to become the abdominal aorta once it passes through the diaphragm. The inferior vena cava is here in the posterior wall of the liver. As we go further down, the first big branch we're expecting to see in the abdomen is the celiac trunk. That's this guy, coming off the aorta pretty quickly after it enters the abdomen, and it's going to give off a splenic artery. You can see that happening right here, running through the pancreas itself to get to the spleen. The splenic vein, by the way, is this big guy right here coming across, and it's going to meet the superior mesenteric vein, which is probably this guy right here. And when they fuse right there, they become the portal vein, or the hepatic portal vein, taking blood from the gut and spleen to the liver, where it's metabolized, detoxified, etc. So let's jump back now to the aorta, and we can see there's the celiac trunk leaving. Other branches are going to travel to the liver and the lesser curvature of the stomach. And then, very quickly after that, the superior mesenteric artery is going to leave the aorta. Now it's going to travel anteriorly because it's traveling in the mesentery of the small intestine, as well as providing blood to the transverse colon, the ascending colon, the cecum, and the appendix. And as it travels, it's actually going to pass anterior to the third portion of the duodenum. And that happens right here. So here's that third portion of the duodenum. And here's the superior mesenteric artery. So follow the dot just to the left of my pointer. And good. So that relationship's important because you can sometimes have the duodenum get compressed if that artery pinches down on it too hard or gets traction from the gut. So that's superior mesenteric artery. Right now, the the abdominal aorta and inferior vena cava have become good friends. They're hanging out next to each other right here. So we travel a little further down, and hopefully I'll actually be able to see the inferior mesenteric artery leave the aorta. It's doing a good job of hiding. I think it's actually happening right there. You can see a little bud come off the aorta there. And if we follow that bud, it's probably going to wind up running to the sigmoid colon and the rectum. And that is what's happening, although it's a little tough to spot. Continuous advance of that. So that's inferior mesenteric artery. The next thing that happens, at least the next big thing, is that the aorta will cease to exist when it splits into the right and left common iliac arteries. And that's happening, watch it right here, right there, boom. And the vena cava right beside it, boom. Branching into the left common iliac artery and vein and the right common iliac artery and vein. They're going to split again, pretty quickly actually, into an external and internal iliac artery and vein, and that happens right here. So it's pretty subtle, but right here, watch the artery. It's going to split into an internal branch there and an external branch here. The veins follow suit a little bit later, and the internal iliac artery and vein on each side go to the pelvic organs, and the external iliac artery and vein are going to travel anteriorly to become the femoral artery and vein. We'll just watch them glide their way through the body wall, cease to be external iliac as soon as they pass under the inguinal ligament right here, and boom, magically become the femoral artery and vein. And then the deep femoral artery will branch off right there, and the remaining femoral artery stays right there, and we run out of scans at that point. So that's the big thing going on with the blood. I'm going to scan back here and here as major muscles on each side of the vertebral bodies, and now we can find the kidneys. Okay, so right kidney, left kidney. Left kidney is a little bit more superior because it doesn't have to push the liver out of the way. The liver's not pushing down on it like it is on the right side. So here, one thing I want to actually note is the adrenal glands are not super visible, but they're going to be hanging out just superior to the kidney. So right here, and then we get our kidneys coming into play. And the renal cortex, the outer layer, is a bit brighter. The inner area is the medulla, it's a bit darker, and the very dark area is the urinary space where there's actual urine being released. Now I'm going to back up a little bit, and I want you guys to see if you can spot the thing I spotted. It's pretty subtle, and I only knew to find it because I was looking for it. But right there, see that extra bright dot just above the pointer? Kind of about 11 o'clock, 12 o'clock on the pointer there. I think that's a renal calculus or a kidney stone, and I think that was actually, in a way, the cause of my abdominal pain, because we're going to see a few more of these as we go down. These were undiagnosed at the time, so a little bit of annoyance there. But before we do that, let's check out the left renal vein draining to the inferior vena cava. So there it is, traveling across there. Nearby we've got the left renal artery paralleling it into the hilum of the kidney. Likewise, here on the right side we have the vein traveling in right there, and the artery passing posterior to the inferior vena cava on the right side. Okay, so now for the big show. We're going to follow the actual drainage of the kidney, the ureter inferiorly. So here is the urinary space, my renal pelvis, the large little sac that gets all the calyces, all the urine draining into the minor calyces, the major calyces go to the renal pelvis, and it's going to consolidate down into my teeny tiny little bitty ureter, which is just above the pointer here. We're going to follow it down into the pelvis, and it's a little tough to keep it straight from all the other gray stuff that's nearby, but it's traveling on the anterior portion of the psoas major muscle. We travel a little further down, and it's going to be medial as we pass further into the pelvis. So it's still medial, it's still posterior. It's going across the iliac vessels, descends fairly posteriorly, and now we're about to start seeing my urinary bladder, and it's going to transition in this way. But look right there. Bright dot, followed by another bright dot, followed by a far brighter dot right there. And that bright dot and the others are renal calculi that were lodged in my ureter, and very likely the cause of my abdominal pain, except I wasn't aware of them, nor was I aware that I passed them. So very interesting to have those guys there. Another possibility would have been calcified lymph nodes, but they're right along the course of the ureter and likely to be the cause of the problem. And you can actually see some others on my right side here. They're a little more subtle, there's not as many, but right there, right into the ureter. So I've never had kidney stones to my knowledge before, but I think I've just diagnosed myself with them by reviewing these CTs. One thing about me that I think has protected me from having kidney stones that frequently, even if they develop, is I, for fun, do one of those martial arts where you spend a lot of time flinging yourself into the floor, so there's a lot of impact, and I think it probably knocks a lot of this stuff loose in my kidneys before it's a chance to get big enough to really actually cause any problems. Okay, so now we're pretty much at the end. The urinary bladder is here, and as we track inferiorly, it gets further and further compressed until we get to the prostate, and the prostate's just here, anterior to the rectum, hence why physicians will do a digital rectal exam to examine the prostate. If you go a little further down through it, we're passing into the urethra. Alright, thank you guys all very much for sticking around with me on this little journey through 3D anatomy slapped into 2D planes. This has been the horizontal view of the abdomen and pelvis, and as a fitting send-off, I want to leave you guys with my very happy looking sacrum. So there's my sacrum, it's smiling at you, and if we go a little bit further superiorly, you'll actually see that it gets more and more happy to see you, and so happily surprised. So yeah, it's glad to see you, it's very glad to see you, and now it's incredibly happy that you came to watch this video, and I hope you guys have an excellent rest of your week. Have a good one.